I'm Karen Mizner. I'm the current president of FreeThought Fort Wayne, and I welcome you all. We thought that this topic was particularly appropriate in view of the coming elections in less than 2 weeks. So we're thrilled to have you here. I want to talk a little bit about FreeThought Fort Wayne. We are a chapter of the American Humanist Association. Both they and we are 501(c) registered nonprofit organizations. We provide these kinds of meetings free and open to the public as part of our mandate. The AHA's philosophy is, humanism is a progressive philosophy of life that, without theism or other supernatural beliefs, affirms our ability and responsibility to lead ethical lives of personal fulfillment that aspire to the greater good of humanity. One of their slogans is good without a God, and that's what we aim to do. So to further that effort, we not only do these kinds of talks, but we also do community service. We hand out gift bags of necessities to the homeless. And it's anywhere up to 40 people who collect these bags. And it's all free to them. We pay for or solicit all of the donations. We also offer our services at Community Harvest Food Bank, where on a Saturday we will hand out food to perishable food. The last time we did it a few months ago was 654 families in 2.5 hours. Very organized, and it's very fulfilling. Believe me, when you get home, you're exhausted, but you feel really good that you have these people, and they really need the help. We also, in conjunction with that, do an ongoing food drive of non-perishable items, canned goods in particular. They want protein, so we give them tuna and beans and canned chicken and stuff like that. But they also take vegetables or anything else you want to bring. We also have a function here the third Wednesday of every month that's called Meeting of the Minds. Meeting of the Minds is like a Socratic discussion group where the participants bring their questions or their topics of interest, and we write them on a board, and then we vote on them as a group. And the one that gets the most votes is the one we talk about for the next hour, and if we have time, we might do a second subject. And it's on any subject you want, so whatever you're interested in. We have another one coming up soon. We are also starting a new initiative called Humanists Helping Hands. Right now, this is open to our FreeThought Fort Wayne members, but it's going to, we hope to have it open to the general public. And what this is helping people who are sick or recovering from surgery, need to be driven to doctor's appointments, or need to get groceries or have a meal given to them or prepared for them. So we've had a few of our members use the services already. We make daily calls to make sure that they're doing okay and they don't need anything. So we're hoping that eventually that we'll be able to open this up to the general community at large. Now, Dr. Jonathan Walker, practices here in Fort Wayne. He is affiliated with both DuPont and Lutheran hospitals. He has 24 years of experience practicing on his patients. And with that, I think I'm going to turn it over to Dr. Walker, and please give him a hand.
Yeah, well, first of all, I'm really grateful that anyone is showing up for a discussion on healthcare, because it is a complicated subject, as our president has pointed out. And you know, I've been in Fort Wayne for about 24 years, but I've actually been a physician for 35 years. And I would tell you that almost every single one of those days, I've seen people hurt by our healthcare system, people struggling not to go bankrupt, people who make decisions that end up damaging themselves, their family members. And I see each one of you spending thousands of dollars more than you really need to get health care. And that's why if anyone's interested in this stuff, I'm happy to come and talk about it. And what you're getting here is the systems engineering department at the graduate school there at PFW. They have me give a 2-hour talk on our healthcare system because the systems engineers are so utterly amazed at how messed up our healthcare system is. It's a really good graduate project for them. So this is going to go deep, and it's apparently about an hour or so. You won't hurt my feelings if you fall asleep, if you need to leave. Also, feel free to ask questions. I'm happy to interrupt myself at any point. And hopefully hopefully you'll find it useful. Always start a talk with a disclaimer. Okay, where does the money come from? I need to remind you that I am a physician. Okay, so if you get sick, I start making money. The sicker you get and the more I do to you, the more money I can make. And maybe you want to take everything I say with a grain of salt because of that. I leave it to you. All of this information is freely offered, and I hope that it's balanced, but definitely look into it yourself, search it out, try to figure out what's good for you. By the way, I have to add, since I'm an ophthalmologist, I love that too. So if at the end you have questions about your eyes, we can do that as well. We'll just cover the whole thing. All right. So what is this thing called single payer? It's becoming very confusing. A lot of Democrats are using the term Medicare for all to refer to things that aren't truly Medicare for all. So in terms of single payer, we have people that need care, okay? And the money needs to flow from the patients to the providers. Now in America, we've managed to split that up into all sorts of different things. We pay taxes to the government, we pay state taxes to help cover our insurance, local taxes. We've got large groups, companies, organizations, schools, everybody's paying into that pot. And there's all the different companies that are part of the insurance industry. So you can already tell right there's a lot of room for, people dipping into that flow of money, for confusion, for bureaucracy. And when we talk about a single payer, I'm sorry?
Don't forget the veterans.
Okay, I can't spend too much time putting all my slides here. I can put that right here, actually. But the point is, when we talk about single payer, all we're really talking about is everybody putting in the money into one pool, which in America's case, that would be Medicare, which we're already all putting money into anyway, and using that single pool to pay those providers. There's other names for it, okay? National Health Insurance or Medicare for All. Right now, they're talking about using Medicare for All for Medicare buy-ins and allowing people to buy Medicare. It's important to understand that that's kind of different from the kind of things that have traditionally been considered Medicare for All, so it gets kind of confusing. All right, why would I, interrupt my practice and come out to give a talk like this? And this is an example. These are pictures of the back of the eye. This is what we see. You don't even need to be an ophthalmologist to recognize that this retina, the back of the eye, is pretty messed up. And we can replace the front of the eye, cataracts, LASIK. We don't care about that in my practice. We take care of retinas. If the retinas don't work, it's gone forever. It's part of the brain. We can't replace it. This is a relatively normal retina. This one has problems. This belonged to a young man who was married, had a couple of kids, working as a security guard, didn't have insurance, and then he lost his job, especially didn't have insurance then. And then it's a decision, do I feed my family with the less money we have, or do I go get an eye exam at LensCrafters for $60? And the decision was obvious, and my partner and I were so frustrated by people going blind needlessly that we got a grant and put a camera in Matthew 25 so we could photograph the diabetics to try to catch them before it was too advanced. Unfortunately, this gentleman was worse than legally blind. We couldn't help it. We managed to save his other eye a little bit. But the problem is that when it's this bad, usually all kinds of other things are going on. Their kidneys are failing, may need amputations, and people often don't realize their eyes are bad until it's really far advanced. So if we can catch that early, that's better for us. But the point in this case is he's doing okay, he's alive, but now he's costing us all hundreds of thousands, if not millions of dollars on disability, all for lack of a $60 eye exam 2 years before these findings occurred. And I think for many of us in this room, that's the end of the story, okay? It's a moral issue. People are dying. People are going blind. People are going bankrupt. This number is older. 45,000 Obamacare has helped that. It's decreasing number. But the point is, we're the richest country of the world, and we're hurting people. And we should just stop, fix that, spread out universal care. But the interesting thing to me is I give this talk, and I relay this story. Not infrequently, people will raise their hands and say, wait a minute, I feel really bad about this guy, but if I had diabetes, I'd get training, I'd make sure I got a good job, I'd make sure I had insurance. I feel real bad about him, but I'm not sure I really want my money taken to support him. And that's another moral view of this argument, okay? Some people find it very, very frustrating, the idea of their hard-earned money being taken away from them to pay for people that they perceive as not being worthy, or on a deeper level, they're afraid that by giving away care, they're going to undercut the roots of our society. People will become, dependent and entitled, and it's just going to destroy everything for everybody. So I was really struck by this incredible dichotomy. And it's very interesting if you get into this. There's a great book, some of you are probably familiar with it, called The Righteous Mind by Jonathan Haidt. And he did an online survey of over 100,000 Americans. And he identified 5 moral values that seem to be important to us when it comes to political thinking. And on this graph, we got very liberal, very conservative. These 5 values are fairness, okay, altruism, justice, rights, care, caring, empathy, gentleness, those qualities, loyalty, patriotism, self-sacrifice, one for all for one, authority, deference to leadership, and sanctity. Bodies are our temples. We don't really want to desecrate them. And as he traced these moral values across the political spectrum, he found some very interesting things. When we look at what liberals favor and what conservatives favor, there's a striking difference. On the conservative side, loyalty, authority, sanctity become important. On the liberal side, fairness is much more important. And the fascinating thing about this is it means that we're looking at the world through profoundly different lenses. Okay, I think you can see how this plays out. On one side, when we're worried about fairness and caring, when we see immigration issues occurring, when we see healthcare being taken away, that scares us. We feel that those policies are increasing suffering. But on the other side, where you're worried about loyalty, authority, sanctity, the importance of our American heritage, anything along these lines can be very threatening. So we have 2 opposite poles just chewing away at each other, but both of them feeling that they're providing a valid moral service. They're both coming not from a selfish standpoint, but from a sense of really highly valued morals. And so we end up wondering which group really does have the moral high ground. And it's more complicated than that, because when we look at things, you realize that this isn't something you can necessarily debate. A lot of this stuff may be genetically hardwired into us. Evolution isn't stupid. Evolution is going to give us a point spread of characteristics. We know that we survive as a species if we've got some on the conservative side, some on the liberal side, and those 2 philosophies kind of give us different advantages under different circumstances. Excuse me. And it's even more interesting than that. When we look at the neuroanatomy of this, okay, we find that there's a high correlation of certain brain structures with conservatives and certain brain structures with liberals. With the conservatives, we find that there's a larger amygdala. I'm going to be very oversimplified in terms of the neuroanatomy here. But the amygdala is part of the limbic system, which is part of the older brain that's in charge of our safety. Okay, it's in charge of looking for threats, responding to threats. That's the fight or flight part of your brain. That's the part of your brain that listens for sirens or jumps when you hear a loud noise. The liberals tend to have a larger intercingulate cortex. Those are the more modern parts of the brain, often require a lot more processing. I don't want to use words like sophisticated or higher, because that creates a judgment, but it's a different part of the brain that often is more involved with socialization, emotional regulation. And the problem is, when we're stressed out, that the liberal part of the brain tends to shut down. Okay, and this is something we see in the political debate all the time. All you need to do is trigger the amygdala, and we all kind of turn into conservatives. As a matter of fact, Jonathan Haidt makes the observation that, if you want a group where there's justice and everyone's heard and it's fair, you get a bunch of liberals. Okay, but if you want a group that gets things done, you get a bunch of conservatives. And it kind of plays out, because this is responding to some of those older, more fight or flight kind of parts of the brain, whereas this responds to some of the higher levels. And unfortunately, it doesn't take much to trigger that amygdala and switch off the higher levels that are required to really understand some of the nuances of policy and healthcare. And this is the kind of stuff that just drives me nuts. This is from 2009, back in the middle of the Obamacare fights. And you may recognize the name Frank Lutz. I guess he's on Fox News. He's a pollster. And he came up with this 28-page memo of what words to use to scare people. Okay? We need to have an open debate. We need to talk about this stuff. But because they're working from the basis of the amygdala, it becomes so easy to just frighten people. Like, here's a classic sentence. The word ration does not induce the negative response you want, but what you really want audiences to focus on is the consequences of rationing. As you can see, rationing tests very well against the other healthcare buzzwords that frighten Americans. And this is so tragic, because we need to have a discussion about rationing. We need to decide about end-of-life care, huge amounts of money to buy people an extra month for cancer, procedures that maybe aren't as effective or cost-effective as we think. We need to have those discussions. But here we are trying to find words that just plain scare people, because if you can scare them, you kind of shut down the more advanced, the more sophisticated process. And we ended up seeing things like this, which we're certainly seeing now. If you remember the president's op-ed about Medicare for All, this is John Boehner. He manages to stuff 1, 2, 3, 4, 5 of these sentences, 5 of these phrases, these scary phrases, in one tiny little sentence. And it just hijacks the whole debate. I could say, you don't want a government takeover of healthcare, and then tell you 2 anecdotes about Canada, and shuts down everything I'm about to say. It's going to take me about an hour to undo, okay, the fear that this instills people. So we're coming back to this. It's a moral issue. And as I give these talks, like I mentioned, this is a deep, important thing. I mean, I've had to hire off-duty policemen to give this talk because places were afraid that fights might break out. I gave a talk at a church up in Goshen several years ago, and the minister prayed with the congregation that people wouldn't start screaming and fighting and hollering. And it really made me realize, is there anything we can do to bridge that gap? Is there anything we can do about, as far as looking at our healthcare system, to kind of cross that divide? And so that's where this talk comes from. Not trying to convince you about single payer at all. With this talk, I'm really mostly trying to convince people to allow single payer into the debate, to let it be discussed rationally rather than just dismissed with some sound bites. And the one thing that no one can argue with is this. Our healthcare system is massively expensive, far more expensive than it needs to be. This graph of other countries, now this isn't outcomes, this is just cost. And the red line, just way off the charts, is the United States. And of course, as soon as I mention that, every one of you is coming to conclusions about why that is, okay? And they're all valid. You know, doctors make too much money, people's lifestyle's bad, drug companies are looking for the money, uninsured costs, end of life care. I mean, all of these things do contribute to how expensive our healthcare system is, but none of them really explain why it's so crazily expensive. This slide has a lot of ramifications. But it's important to understand that one of the knee-jerk things we think is that there are certain things that explain the expense of our healthcare system. We're not healthy, we've got lawsuits like crazy. And I don't have time to do this. It could be another separate half-hour talk, and I invite you again, do not believe what I'm saying, look into it yourself. The American healthcare system is not expensive because we're sicker, or we need tort reform, or any other simple reason. The American healthcare system is expensive, and it's nicely captured in this article title by the Princeton economist Louis Reinhardt and his group. Basically, our system is expensive because our system is expensive. That's all there is to it. The prices are high. Why is it that way? Well, now I have to go to anecdotes. Okay, I'm going to try to keep my mouth moist here. I do a test called fluorescein angiography, and that's a test where we inject dye to see what the blood vessels are doing in the back of the eye. These numbers are a little bit older, but depending on your rent and how recent your cameras are and how many techs you have, the test costs maybe $25 to $200. I have an older practice, so maybe $50. Medicare pays about $250, national like $125. Private charges, you know, in doctor's offices, you have the Medicare and the Medicaid costs or fees that you're paid, and then the private insurance companies pay variable amounts above this. Private charge is about $450. So you know, this is pretty helpful. It's usually a good profit in terms of the money. It's obviously a very valuable test. If you want to get your doctor to listen to you, you should do what this patient did a few years ago when he came into the office and he told me I was stupid. And that will get your doctor listening. And what he did, it had nothing to do with the care. He showed me a bill he received from a retina group in Toledo. Okay, and on that bill, they billed private insurance $1,200 for the angiogram that cost them maybe $100 to do, and the insurance company paid. Okay, he said, "Doc, you're stupid. You should be charging more." Now, what do you think happened to our prices after we saw that? We're not pirates. Okay, we didn't go up to $1,200. We did go up maybe $50 to $100. But the point is that has been happening in our healthcare system for decades. And that creates this incredible inflationary spiral. As one doctor sees, wow, I can bill $1,200. What's to stop another doctor from billing $1,500 or $2,000? And that's been happening across the board. Now, it's obviously changing now because our healthcare system is so insanely expensive that everyone's trying to ration it down. But those incredibly high prices have showed up because for this long period of time, there was so much money sloshing around in our healthcare system that you could get what you asked for. It would just be paid. And so we end up with graphs like this. This is just an example. I'm sorry, it's a few years old, but it's the cost of various procedures in America compared to the rest of the world. You can see the rest of the world has various prices. What's this for? Normal cesarean delivery. In America, we're kind of all over the board. We've got Medicaid prices, we've got private insurance prices, and this is not isolated to delivery. This is just an example of all kinds of different things. Imaging, hospital stays, physician fees. It turns out the purple is always America. All these other countries have decided that, okay, we're going to set a fair price that seems to work for people, but in America, we've got these prices all over the place. Again, going back to this ability to charge whatever you want and get paid for. This is, again, a few years ago, but the cost of a colonoscopy in the Bay Area ranged from about $900 to $7,000. There's no systematic way of looking at this. So we have these incredibly expensive prices. What do you do about it? Well, there's two main ways to control costs. One is what every other developed country in the world does, and that is sit down and agree what will be a good price that will cover expenses, allow profits if it's that kind of a system, and people seem to get along with that. But that's not how we do it in America, okay? And by the way, there's lots of different ways. A single-payer system is actually one subset of all the different ways that these different countries have chosen to do this with various amounts of public and private. The frustrating thing, again, if I say you don't want government takeover and give you a couple of anecdotes of Canada, all of this data, all of this information, all of these approaches are just thrown out the window. We will not consider them because we're America and we're going to do something different. So what does America do? Well, we make you guys pay more for your care, all right? That creepy term gets skin in the game. I mean, that has real connotations for me for, certain things that happened in the last century. But that's the way they look at it. They figure if you have to pay more, then you'll become smart shoppers and healthcare costs will go down. And that has very definite consequences, okay? That's where we get these things like the high deductible health insurance, the high copays, all that kind of stuff. Now, it turns out there is some data that suggests that can help a bit. There was a huge study that ran a health insurance experiment, and it did show that the high deductible group, the people that had to pay more for their visits compared to the group that didn't have any high deductibles, went to the doctor about 30% less. But it turns out it's kind of useless stuff like coughs and colds and flu. It didn't really save a lot of money, but it did decrease utilization. And we have that sense. Again, we're Americans. We want to get people, we got to get people involved. We want to see patients interested. And it does. When people are starting to think about how much they have to spend, they may start shopping and comparing or asking about the cost of x-rays. Usually not, okay, but it at least gets people pointed in that right direction. And like I said, it kind of feels right. That sense of, we're independent, we're going to work hard, and we're going to work for our own health care. So it resonates with us, but it actually doesn't do that. And this is a real thing. I mean, those of you that are working, employed, you're seeing this happen. You're being switched over to high deductible plans. Or because of that first graph, the expense of our healthcare system, your employer is asking you to pay more and more of your premiums. This is just workers' wages and inflation. And the other two things are premiums and increasing the deductibles. So in other words, you're trying to make more money, but the money is getting sucked away into our healthcare system. When I show you that graph of America's insane, outrageous prices, you're feeling it every time you go to work. And we'll talk about that a little bit more. The big problem with this high deductible stuff, though, is it backfires in a big way. What happens is, as you might imagine, if people are scared about going bankrupt, they forego needed care. So they end up sicker. They don't get the blood pressure pills, so they show up with a stroke. Or, hard on parents, the idea of parents who are struggling to have to come up with several $1,000s at 3 in the morning because their kid's really sick. Do they go to the emergency room and really create financial hardship, or do they try to get by the night with Tylenol? To me, that is just such a horrible thing that we do to people. And like I said, prescriptions aren't filled. creates financial difficulty because many people are just getting by on their present salaries. So if you ask them to pay several $1,000s to deductible, then it's real trouble. And there's other things that are kind of wild about this high deductible stuff. And this, it just lets you know how really frustrating our healthcare system is and how we've set it up. And this becomes important.
Bother anybody.
Yeah. Yeah.
Talking about that, about 50 years ago when my mother was a nurse up in northern Michigan, one of these cherry pickers got hurt, got very badly hurt.
Mm-hmm.
The family just left him. There was no way to pay for it. They just moved on and left him.
Wow. Yeah. So that's, we have an amazing healthcare system that can do amazing things, but it can also be profoundly barbaric. And don't worry, we'll be covering it. But this slide is important if you happen to be a woman or are related to a woman. When people start kicking into high deductible health care plans, that's like a $1,000 or more pay cut for women because women tend to have higher health care costs, okay? They do very frustrating things like have babies, or they get breast cancer, or they live longer. And so when we throw everybody into the same pot, if people are having to pay that first $3,000 because women need more care on average, they just lost $1,000 of their salary. Or you can flip it around, which is that men who don't have uteruses and breasts get $1,000 extra, largely because they don't have to deliver babies, which is very ironic when you think about who gets women pregnant in the first place. But the point is, it's just one sideline of why this high deductible stuff is so frustrating. The really frustrating thing for me as a physician is we've managed to create a healthcare system that's economically self-perpetuating, okay? So we know that 70 to 90% of things that people go to the doctor for, besides upper respiratory tract infections, are either stress-caused or stress-related. Blood pressure, headaches, back pain. So people come into the doctors because they're having some sort of stress-related problem to try to deal with it. They go to the doctor and suddenly they've got a bill. So they've got financial worries on top of all the stress they started with. So now their stress goes up. So getting care equals more stress. So as we provide care, we can get them more stress, and we just generate a cycle where we can start recycling people through the healthcare system and make more and more money off them. Now no one really consciously thinks that's the case, but this is what we've done to our people. And there's a name for it. It's called financial toxicity, where doctors need to take into account not only the side effects of the drugs or the complications of their surgery, but what they're going to do to the patient and their family if they write a prescription that they can't pay for, or what they're going to do to the patient if they order an MRI that's going to make the family struggle to feed themselves for the next month or two. And I see this every single day in my office. I can't tell you how many times. In my practice, if people don't get in, they can go blind. And they don't have symptoms, like I said, until it's more advanced. So every day I'm telling people, look, if you have a high deductible plan, if you can't afford this, just tell me, we'll write it off, we'll treat you for free. Because if you don't get in here, I can't keep you seen. And this is what our healthcare system has done, again, with this sense that if we just get people skin in the game, if we just make them pay, they're going to smarten up and they're going to get straight and they're going to just fix the healthcare system. But it can't work, okay? Like I said earlier, these high deductible plans, they only have a small effect. The randomized trials show that it just maybe keeps people with a cough or a sore throat away from the doctor. It doesn't affect people when they're really sick. People, like I said, put off needing care, they get sicker, okay? So that already makes them sicker and costs all of us more. And when they do get sick, they blast right through the deductible. So there's no cost control anymore. The hospital and doctors are now tapping right into the insurance plan like we've always done. Women automatically have to actually put up with at least $1,000 pay cap. But the real reason why these high deductible plans can't work is because, darn it, if General Motors and the U.S. government and Anthem and Cigna and all those places haven't been able to control costs, it's really hard to imagine that Mrs. Jones and her high deductible plan is going to do anything to help control costs. But the frustrating thing for me as a physician is no one's paying attention to that. There's this sense in our healthcare system that if we just make it more complicated for people to get care, then maybe it won't cost as much. And when you think about it, that's like the opposite of what a healthcare system should do. A healthcare system should be available to provide healthcare, not think about what kind of obstacles we can create to make it tougher for patients to get care. But it's the system we have, and it's certainly the thing that's being pushed all up and down the political spectrum. Okay, so in addition to this whole problem of the high deductible stuff, we have this other issue, the uninsured. And this is where I encourage you to kind of think about it as Jonathan Haidt would, the people that view offering insurance, offering healthcare to people can undercut society, can take your money away and give it to people you don't think are deserving, or you feel like you're being taken advantage of, or you feel like care won't be there when you need it because it's being given to all these losers out there. And this is a set of points that I'm going to make to help you maybe convince people that it's not as simple as that. So like we said, first of all, it's a moral issue, okay? All this stuff that keeps people from seeing a doctor, a lot of it is driven by anecdotes, the amygdala. If you go into the doctor's lounge, the classic story is, some probably obese, probably person of color, Medicaid patient with a new iPhone and tattoos showing up at 3 in the morning for care for an upper respiratory tract infection. And that kind of anecdote resonates so strongly. And it's sad because that kind of anecdote starts to dictate policy. But I'm on the ground. Yeah, maybe there's some people like that. But I see all the people that are hurt by it, the collateral damage, the people that are working and struggling and trying to get by, and they're scared that they can go bankrupt. So even if the moral issue doesn't appeal to people, recognize that there's a lot of collateral damage, there's a lot of suffering that's created by the way we try to keep people from going to see the doctor. But there's a couple other points to be aware of. If we're going to have a whole bunch of people that aren't insured or underinsured, remember, uninsured people with high deductible plans behave just like the uninsured. They're scared to go to the doctor. So it's really the same thing. The problem is you're going to pay for it either way. Sorry for this busy slide, but this is data from about 10, 15 years ago, where they looked at how much it costs when people don't have insurance, get sicker, end up going to the hospital with needing a lot more care, more time off work. And they calculated that we actually pay about 5 times more when we keep people uninsured than if we just give them insurance in the first place. It's vastly more expensive for us to have a whole bunch of people that are uninsured. So if you're worried about efficient and careful use of your dollars, you have to prepare yourself for the fact that you're going to want to help out the uninsured. It's going to be cheaper for you to just provide them with the care they need. That's very counterintuitive. Okay, but it's just the way it is. Again, I see that every day. And then there's another aspect of this that I think is super important to understand. Again, a very busy slide, but this refers to research that talks about how if you have a bunch of uninsured people in the community, they get sicker, okay? And when they get sicker and go to the emergency room, they tie up resources. So suddenly, if you have a bunch of uninsured people and they're tying up resources in the emergency room, you can't get the care that you want for yourself and your family. For every 10% of uninsured in the population, the chance of having difficulty care rises by 7.7%. As a matter of fact, there was a study in the Bay Area back in the 90s, and they estimated that for every 25 people that had a heart attack in the Bay Area, one of them died, largely because the paramedics, the nurses, the doctors were tied up taking care of uninsured people that presented far sicker than they need to. So if we're going to have uninsured people, if we're going to create high deductible plans that scare people from the doctor, we have to be prepared to live with those scary consequences, okay? That's not imagination. That's not, oh my God, someone's going to take my money away and I won't get care when I need it. That is a real thing that happens. I've had to send people to Indianapolis because I've been so tied up with Matthew 25 patients that I couldn't see them. And then the third thing, this is Tim's talk about practicing. If you go to your doctor, and this is, I just right-clicked this doctor off the internet, so he's obviously totally wholesome, maybe an actor, whatever. But this guy looks like he's trustworthy and knows what he's doing. And if he's good, who's he going to have with him? Okay, he's going to have a bunch of students with him. And if that doctor tells you that you need a really complicated surgery, It's going to be very difficult, maybe life-threatening. What's the first thing you're going to think of? And maybe not in this group, but for many people, and it's very reasonable, you're going to ask that doctor to not let the students practice on you, okay? Don't let them practice on you because they're kids and they don't know what they're doing. You want your well-trained doctor to be the one operating on you. Well, how do doctors get practice, okay? How do they get trained? In America, they train on poor people and prisoners, all right? So if you want a well-trained doctor to take care of you when you're sick, you better be sure that you're providing that doctor with the resources to learn on those other populations. And yes, some of those people make profoundly bad decisions, but if you want doctors to have good training, you have to support the county hospitals. You have to support the teaching hospitals. You have to support academic medicine. You have to be willing to put some of your money into that system to help people that you don't perceive are valuable if you want that doctor to have the knowledge and skill it takes to take care of you. So this is a big thing for me. It's just why we are willing to put up with the uninsured. It's just kind of what we've gotten used to in America. But there's consequences that affect us. The moral issue, and I think there is kind of a psychological overhang of living our lives knowing that there's people out there that are struggling to stay alive. It's just by accepting that, I think it is kind of something that kind of lingers with all of us. It costs us more money, and it endangers our health when those people are tying up the emergency room, and it risks the training of healthcare providers. So it's really important to understand that when we block people's access to care with high deductible plans and they don't have insurance, we're going to be paying for that at several levels. All right, digging into our healthcare system and all the things that we have to deal with. Another big problem is quality. So this is one of those life expectancy at birth graphs, and I freely admit that this is not a great metric to judge a healthcare system. Everyone will argue that the numbers you need to find out if you're including premature babies, which skew the average and all that kind of stuff. I think the point is made, however, that for spending more money than any other country, America doesn't seem to do well. But like I said, I agree that's not a great metric. So we look at number of infant deaths. And again, people will argue about what we call premature, what we call live birth, what we call a possible viable birth. But still, for all the money we spend, America has greater infant mortality. And you can argue about life expectancy and infant mortality, but it's kind of hard to argue about maternal mortality. And again, the red line in America, by far and away, we have the highest mortality rate. And because people will vehemently argue that these are not good metrics, Professor Aaron Carroll down at IU decided to look at about 60 different metrics, okay? He looked at all kinds of different things. First, the population statistics. And then he looked at, disease care and technology and utilization, all these different studies. And he just put them all together in a big pile to see how America did. And unfortunately, we do remarkably poorly, okay? You can argue with individual studies. That's what people do. They say, oh no, that study isn't valid. But it's striking that when we look across the spectrum at all the different studies, America, yeah, we've got great technology, but we don't come in so well at all these other areas. And how does that work? Because I feel like when a patient comes to me, I'm giving the best care I can, and I think you guys probably feel that your physicians are doing everything we can, but somehow we're striking out. We're not getting it done. Well, one variable happens to be how much money you make. This is a slide of life expectancy versus income. And in America, if you're in the top 25%, you're going to be okay. All right, but if you're anything lower, then your life expectancy drops down. And this doesn't mean that it has everything to do with your income. There's obviously lots of other things in terms of education and lifestyle changes and all that kind of stuff. But it's striking that we kind of distribute our results along this income spectrum. And this is an even more detailed slide where it breaks it down to men and women and quintiles of income. So, if you're a man in the top 40% of income earners, life expectancy from 80 to 2,200, you're actually going to do pretty good. You're kind of up at the top here. I don't know how this graph compares to other countries, but you're positive. Now, if you're a woman and you're in the top 20%, you're okay. But if you're a woman in the bottom 80%, or a man in the bottom 60%, you're not going to be doing this right. And again, and like I said, correlation is not causality, so we can't say that it's totally related to this. But there's clearly this problem where if people don't have the resources, they can't get the care. And like I just said, if they're not getting the care they need, they're costing you more money. They may be in the emergency room when you need care, and if you're not helping doctors in training learn how to take care of them, you may not get the excellent care that you want. Another aspect, of course, is utilization. This is what I alluded to with my very first slide. In other words, what doctors do. This is an article by Togo Wandi, the great healthcare writer, called Overkill, talking about an avalanche of unnecessary medical care is harming patients physically and financially. What can we do about it? And this is not to scare you away from going to the doctor, but there's tons of studies like this. Okay, this is just a self-referral for imaging. In other words, if a doctor has his own X-ray machine, and economists look at what that doctor does, if you have your own X-ray machine, you get to bill for that, so that's extra money for you. If you don't have your own X-ray machine, you send patients to the X-ray guy down the street, and there's no economic incentive. And believe it or not, physicians who had their own X-ray machine did more than twice the number of imaging. Now this is where it gets really tricky, because the doctors that are doing more imaging, I guarantee you, under torture, they would deny that money has anything to do with it. And they would tell you that my patients are more complicated. I want that extra measure of certainty. I want to avoid getting sued. But even though we as physicians will deny it, when economists look at our behavior, and this is just one study, there's lots of studies like this, but when they look at our behavior, we behave like anyone else. We respond to that invisible hand. If you get a $10 gift certificate to Subway, you're going to go eat at Subway. If we get extra money for doing something, it seems as though we do more of it. So we have a very, very complex and kind of troubling healthcare system. It's hugely expensive. It may not even give us the best results. It may even do too much to us. And it wastes a huge amount of money on bureaucracy. Okay, we've been talking about the quality, the costs to us of having them insured, the cost to us of these high deductible plans, but there's a huge amount of paperwork, needless, crazy administrative that we have to deal with as physicians. And to understand that, this is an extremely important slide. It breaks down the population in 10% groups based on how sick they are, how much care they need. And it turns out that pretty much across the board in any population, about 20% of us use up most of the care. Okay, these are the older folks, the diabetics, the heart disease, the cancer patients. If you break a bone or have a baby, you pop into this for a year and then you bounce back out. So, yes?
The 80-20 rule, which is what that is, works in just about everything.
Yes, and even in the Medicare population.
And even in inventories, everything.
Okay. Well, then, yeah. Let's see what it means to your pocketbook. All right, because if you're an insurance company CEO, who would you want to insure? Okay. Obviously, you want to take care of these people that cost very little. The premiums that these people pay, that 80% of the population, it's free money for the insurance companies. And the really frustrating thing is, we've got this. Okay, we'll talk about this, but they figured out in the 60s that they could unload the sickest and poorest on all of us. Medicare, Medicaid, subsidies, all that kind of stuff. So they freed themselves of all the expensive people so they could concentrate on the people that bring them money. And that's the rest of us. We end up shoveling that money into those companies. And again, I don't mean to demonize any particular set of people or business. I know that some of you probably are in the insurance industry or have been, and I know it's filled with good people who genuinely feel they're bringing value to the system. My point with this is, we need to decide as a society if we want to continue this, if we're really getting our money's worth as we get divided up like this. And my favorite quote is from Angela Braley, the former CEO of WellPoint before it turned into Anthem. And she said this beautifully Zen sentence. And this wasn't marketing to you, okay? This wasn't trying to sell stuff to brokers. What this was, she was talking to stock analysts. And she was letting them know that they are number one. We will not sacrifice profitability for membership. Making you guys money is more important than taking care of the people we're supposed to take care of. And again, that's not evil. That's appropriate and correct business ethics. But we as Americans don't really get a chance to ask if we want that. But as they divide us up into smokers, obese, men, women, pre-existing conditions, all the little ways they can use to kind of separate us and try to optimize their profits, it adds this huge bureaucracy. This is another slide that when I saw this 10 years ago, this actually scared me almost more than anything else. The yellow at the bottom is the number of physicians, providers, okay? The green is all the extra administrators. And yes, a lot of this is dealing with government regulations and whatnot, but a huge amount of this has to deal with extracting money from this incredibly confusing and bizarre healthcare system that we have. Again, to quote Louis Reinhardt, talking about Duke, we have 900 billing clerks at Duke. I'm not sure we have a nurse per bed, but we have a billing clerk per bed. It's obscene. When you think about how useless it is, what those billing clerks are doing, trying to extract money from the insurance companies that have extracted money from us. It's very frustrating when you realize that those people could be involved in patient care. They could be involved in research. Heck, they could be delivering flowers to sick patients, but they're not. And it's a huge cost. This is a very busy slide. It's talking about this BIR. There's a word for it, billing and insurance-related costs. 30% of my office staff every day is spent struggling, fighting to get the money we're owed from these insurance companies. And all of that effort, all of that bureaucracy, all of that paperwork, all that time turns into real money. And this is just the bar showing our healthcare system, how much more expensive it is. And I'm just going to blast through this here. When we look at the money, again, a busy slide, but when we estimate how much extra we spend to take care of all that silly paperwork, it's like $375 billion. That's several years ago. That's almost enough to take care of 2/3 of Medicaid. And so it's very frustrating to me when we see politicians talking about, no, we can't do a single payer. We can't do Medicare for all. We want to give people the right to choose. We don't want the government bureaucrat getting in their way. We want them to take advantage and use their freedom to work within our system. And this is the system that we have. Private insurers, hospitals, pharmacy benefit managers, Medicaid managed care, employer insurance consultants, underwriters. All of this junk has nothing to do with actually taking care of patients. But this is what our politicians insist we want, and we should be able to decide that. Rather than, all this stuff, how about a tax that goes to Medicare, that goes to the providers? And I'm sorry, obviously that's hyper oversimplified, but I think in the context of all this absolute craziness, those of you that just getting a drug, a prescription filled, all of that craziness is really different organizations trying to tap a little bit of money out of the flow of money from patients to providers. And they're very good at it. And the Wendell Potter, we'll come back to him in a second, but he makes a very valid point. What keeps insurance company CEOs up at night is the worry that other CEOs will eventually come to realize that they add more cost and value to our healthcare system. And I'll return to this idea that when General Motors and Apple and all those places start to realize, look at all the resources, all the time, all human resources cost that we spend on shopping and buying insurance, and then our employees are ticked off about it anyway. That's the thing that really scares the CEOs. And we don't even think to realize that. We don't think about that. And it is real money, okay? If you're working right now, this is actually several years old, but if you get insurance from your employer, back a few years ago, it's higher now. Now, if you're single, that's about $6,000 a year, almost $3 an hour. You're paying, you don't see your employer's using that money to buy you insurance. Family coverage, it's like $17,000, over $8 an hour. So let's look at that, because one of the things I wish is, it sounds terrible, but I wish every American could get a chronic disease for about 3 months. Diabetes, leukemia, something, and just see what it's like to have to be exposed regularly to our healthcare system. The other thing I wish is every American could understand how much money they're spending that they're not aware of. So what do you really pay? This bar will represent your nominal salary, what you pay before taxes. What comes out of it first? Well, the first thing is your Medicare tax. And you'll see that on your W-2, at least the FICA Medicare tax. So the government chops off about 1.5% of your taxes to help pay for people over 65 and are disabled. That's that concept of everyone putting a little bit into the pot to take care of the oldest and sickest and poorest. And your employer matches that. Okay, so you put in 1.5%, the employer puts another 1.5%. And then you got your Social Security. Okay, that's about, I think it's like 6% or so that you pay, and then your employer matches that. It's kind of a little kick for your retirement plan. That's why Social Security works the way it does. And then, of course, you have all your other taxes, government, state, local, that chops away. So you end up, with this money as your take-home pay. And one of the problems with our healthcare system is because it's so expensive, our companies have to charge more for the product, so even the money you take home is less because everything you buy from America costs more because of these outrageous healthcare costs. So this is your nominal salary and your employer tosses in a little bit. There's something totally missing in this picture, okay? If we look at this just in terms of taxes, and that is what your employer pays for your insurance. Again, this is $3 to $8 an hour that you do not see. Your value to your employer is actually this whole bar, okay? You don't see your employer paying this, and you usually aren't aware that this is happening. You do see this. So there's a whole bunch of money that's going out there. Remember, going back to that first graph, how expensive our healthcare system is. This is similar to the graph I showed where earnings and inflation going up at one level and health insurance premiums and workers' contributions going up higher and higher. So you want more money. Understandable. You want someone to pay you more, but that money is going off to those health insurance companies. Okay, again, you're not aware of it. You don't see it. And it's powerfully regressive. Chris mentioned the concept of progressive and regressive taxes. A regressive tax means that the less you make, the more you pay. Let's take a look and see how that works. The height of the bar is the value to your employer, okay? So let's say you have a job where your employer is going to pay you $30,000 and $60,000 and $140,000. Where if you've got a family of 4 and you have employer insurance, that's $16,000 a year, you can see that $30,000 just disappears. And then if you have a $4,000 high deductible, your $30,000 a year job suddenly turns into maybe $5,000. And obviously, it doesn't happen that way. We've agreed that we'll at least help people in that area with subsidies through Obamacare and Medicaid. So that doesn't really happen, but I think it gives you an idea of how utterly regressive all of these are fixed costs. So the more you make, the less of a percentage of your income it is. So even if you're making $60,000 and you are getting insurance through your employer, you're losing this much value to the insurance companies, this much to your deductible, and this is what you actually end up taking home. And of course, if you make $140,000, you're paying that same amount, but you get a lot more. It's a much smaller percentage. And that's how regressive things are now, because it's just a fixed cost that everyone has to bear. Progressive healthcare financing means that the more you make, the more you put in. And it turns out that when we actually get rid of all that crazy bureaucracy, all of those drug costs, and actually allow the government to negotiate, and we'll talk about this in a second, well, more than a second, but it actually is cheaper to just set up a progressive tax where everyone puts in based on their income and start to cover all those costs. But the big problem for me is this. We're putting all of this money, into these for-profit insurance companies. And what do they give us? Okay, they give us this regressive tax. Okay, the fact that if you make more, you don't have to pay as much. They value shareholders over patients. They've done a classic thing where they socialize the risk. Okay, we're taking care of the Medicaid patients, the Medicare patients, the kidney dialysis patients. And they've got the healthy work employers that are much less sick. They add bureaucracy, they add confusion, and they add cost. We're basically paying them to give us confusion. The networks, the pharmacy providers, it's such a headache, and we're paying them to do that to us. But we've accepted that as normal in our healthcare system. And I have to say it again. What keeps insurance company CEOs up at night is not only CEOs of other countries, but the rest of us. When we start to realize that their product is confusion, and we want to get our kid to the emergency room, people may start to look at this very differently. And that started to happen back around 10 years ago, prior to the passage of the ACA Obamacare. Insurance companies were starting to get a really bad rap. Books, about what they do, horrible stories like a teenager dying because Cigna refused to give her a liver transplant, blogs, movies, just making the insurance companies really look bad. And they knew that with this kind of stuff building up, it wouldn't be long before people really started to take a serious look at single payer. So they knew they had to do something. All right, what did they do? Well, they knew they had to start covering people, all right? But they couldn't make money doing that. If they're going to actually take care of sick people, they're going to lose money. And most people can't even afford their product anyway. That's why your employer is paying that $8 an hour. It disappears in terms of your salary, but if you were paying that $8 an hour, that would really hurt, particularly if you were low income. So how do they address this? Well, I know as I give these talks, there's some people that are feel deeply that Obamacare, the ACA, is a good thing and needs to be fought for. And it's a very complicated law. There are some very good things about it, and there are some very bad things about it. So I'm going to ask you to try to not think in terms of Obamacare in black and white thinking, because you need to understand that the fundamental structure of Obamacare was designed by the insurance industry. Okay? What do you do if you need to cover people, but you're going to lose money if you do it, and they can't afford your product anyway? You figure out how to make taxpayers pay for it. So that's why we've got the mandates, so healthy people can continue to pay into those insurance companies. Those little tiny boxes in that where the population is divided up into 10% units. You want to, because no one can afford their premiums, you've got to make sure that subsidies are available for anyone that can't afford the premiums through the marketplaces. We pay for the enforcement, okay? The insurance companies have no way of enforcing that, but they can get the federal government through the IRS to enforce it. And a little known aspect of the ACA was the insurance companies had access to bailouts. If they didn't make enough money, they could appeal to the government and get reimbursed. We guaranteed them revenue, and we guaranteed them revenue through our tax dollars. And the best way to understand the ACA is this article from Business Week back in 2009. And the title tells you, the law hadn't been passed yet. What were we doing? We were sitting in town hall meetings screaming at each other, and the insurance companies slipped in with this plan, with this system, and they got exactly what they wanted. As a matter of fact, going back to this Wendell Potter, who was the vice president of public relations at Sigma and had an epiphany, realized that I can't keep doing this. I cannot be part of this process. Wrote an expose. In his book, he points out that if you were persuaded that the healthcare bill was a government takeover of the healthcare system, my former colleagues and I earned every penny of our handsome salaries. The for-profit insurance companies knew that if they could blame the government, if they could get people thinking it was a government problem, they could continue to generate revenue, even when they gave up the option of pre-existing conditions. That was the big victory with Obamacare. That was their strategic mistake, because once I think Americans get a sense that, hey, maybe if a kid has cancer, they should still be able to get insurance for the rest of their life. Or if someone's in a horrible car accident, they shouldn't have to try to work or sue someone to get just barely enough money to care. Maybe we should just get rid of this idea of pre-existing conditions. And so when the new administration took over, there's this almost robotic sense of we must repeal Obamacare, we must repeal the ACA. And they ran into the fact that this was designed by the insurance companies, okay? And that's why they couldn't repeal it, because it's such a beautifully designed tripod that perpetuates the insurance company model and actually manages to take care of people. I mean, again, the law is beautifully thought out if we're going to perpetuate the insurance company model. It perpetuates all that craziness and confusion, but it really is really thought out. So if we look at the various options, we talk about a pure government payer provider. That would be like what you might call socialized medicine, like the VA or the United Kingdom or Spain. That's way over to the left. Medicare for all isn't even that. Medicare is to allow your doctor, allow your hospital to do their thing, bill for what they're doing, and just have Medicare be the insurance company. But if we're trying to keep the for-profit insurance companies, when we move further over to the right side of the spectrum, you see that Obamacare is actually over onto the right. And beyond that is just free-for-all, craziness, okay? I'm sorry if you're a right-leaning healthcare economist, but I just, as a practicing physician, I don't see this ever being being useful. But that's why they couldn't undo Obamacare, because the only way they could do that is really shove things into a totally crazy territory where people lost pre-existing conditions and people lost their ability to get subsidies and all the things that you're hearing about as President Trump tries to dismantle Obamacare. There's real consequences to that, because he's breaking a system that was designed to work, to support us, to provide some goodness for people, the Medicaid expansion, the exchanges, the subsidies, but also contribute to the needs of the for-profit insurance industry. So again, we're back to this slide. An incredibly expensive healthcare system. What does it mean to us? Well, first of all, we get multiple dips. All right, we're paying for Medicaid and Medicaid. We're paying for the sickest and poorest, but we can't have it. That's the oddest thing to me. Is a chunk of my salary goes to support Medicare, but I'm forbidden by law, unless I get disabled or kidney failure or something. I can't have it. So we're all paying for that. The two bars on the far right, the most expensive people. So we're taking that burden off the insurance companies. We pay for the uninsured, as I said, both in terms of the extra costs, cost sharing, their presence in emergency rooms, clogging things up. We make less money paying premiums. Again, our employers are asking us to pay more and more in premiums, and those are getting more and more expensive, so our take-home salary isn't going up the way that we would like to think it should. And all of those premiums bring us insurance company products. Confusion, insecurity, cost, bureaucracy. And we pay more for everything else. Like I alluded to, all of our products are more expensive because our companies are paying so much more for insurance. And now we're paying for the exchanges, the subsidies, and enforcement of the ACA. And we still have those opportunity costs, okay? Education, school systems are struggling because they have to spend so much money on insurance, they can't actually take care of their children. Entrepreneurism, if you want to start a new business, you have to plan on spending a huge amount to offer insurance, because otherwise you can't attract star talent. And job lock, even with the pre-existing exclusion that exists with the ACA, many people are afraid to quit their job and go out into the markets because they don't know what's going to happen, particularly in the current political climate. So we're paying all of this money. We have all this extra confusion. We have all this extra bureaucracy. We have all this intrusion on our quality of life, and we haven't even gone to the doctor yet. Okay, and then when you go to the doctor, you've got your copays and your deductibles. Bam. So that's our system. What is it about Medicare that's so appealing? And why are those insurance companies' executives so afraid that we'll start to think in terms of allowing us all to have Medicare, allowing us all to put some money into the pot and distribute it and make sure we can all see the doctor when we need to? We have to go back to what Medicare is like. If you're not in the Medicare age, you're not really aware of this. And I'll speak about it a little bit. There's Medicare Advantage, we'll get to in a little bit. I'm talking about just straight traditional Medicare. There's no pre-existing conditions. When you hit 65, you pay your Medicare V premium, and you could be halfway dead, or you could be a marathon runner. It's all the same. Basically, you can see any provider you want, okay? It's vastly cheaper than for-profit insurance companies. If you have someone across the Thanksgiving table with Aunt May is saying, you can't have Medicare for all because it's socialized medicine, you can point out to her, wait a minute, Aunt May, we're paying for you. You're not bankrupt and you're healthy because we created a system that's much cheaper. We don't have to worry about the bureaucracy. It spreads the risk uniformly. And Medicare even has better prices. Why does Medicare exist? This is really interesting. Back in the 60s, one of the problems is old folks did something really annoying. They started to stay alive. Okay, medicine actually started to work, and people lived longer. So we had this aging population that couldn't work, but it was a burden on the hospitals and the doctors and the insurance companies. No one can make money off them, and businesses were stuck with their pensions paying for their insurance. It was getting super expensive. So back in the 60s, of course, socialized medicine was anathema. This is the middle of the Cold War. But the real reason Medicare was rammed through is because no one could make money off of the old people. All of those systems, all those organizations, they were saying, look, we're losing money. We got to dump this on taxpayers. And again, I'm sure they didn't say it quite that crassly, but that's the dynamic. If we socialize the risk, get you guys to take care of the sick people, we can still cover the healthy workers, and that'll be cool. You can have the old folks on Medicare and deal with that, and we'll give great service to all the people that work for employers. And the really creepy thing is, back in the Obamacare fights, the country of Taiwan did something very interesting. Actually, further back in the 90s. Granted, it's a smaller country, different population, but they were running into the similar nightmares that we have in terms of uninsured, out-of-control costs, poor access to care. So they did something really systematic. They went around the world and looked at each country's healthcare system, okay, something that we seem to refuse to do here. And they realized that Medicare was pretty darn good. Now, they tuned it up. And again, if you want to spend 2 hours here, we can talk about some of the problems with Medicare. But they improved it, fixed a lot of the problems, and they created a systematic system where everyone can get care. Their medical records are on a card, they can see doctors when they need to, and you have access to huge amounts of data in terms of the population, outcomes, who is abusing the system, which doctors are prescribing or not. It's readily available. And they came to the United States, they came to Washington in 2009 and said, hey, you guys, look at what we did with Medicare. Do you want to listen to us? You want to hear about it? And as you can imagine, no one wanted to listen. No one, the government, the Congress said just ignored them completely. The lunatics like myself, the Physicians for National Health Program, we were all over it. We thought it was pretty cool. But it was just totally ignored. And again, we get back to the cost. When we look at overhead spending of these insurance companies, when we compare it to Medicare, it's vastly better. Medicare doesn't have to pay executive salaries, doesn't have to pay for advertising, doesn't have to pay for underwriters, doesn't have to pay for that person when you can't figure out what drug you can get, that you have to call up on the phone on hold, try to figure out what drug, which MRI, what you're paying. Medicare doesn't have to do that stuff. So there's no way the insurance companies can beat Medicare when it comes to just simply providing revenue for treatment. And this next slide, and I did, like I said, you guys asked for this, okay? But this next slide, I think, is perhaps one of the most important ones again. And this is total health spending from 2015. The blue is Medicare, the purple is Medicaid. Medicaid is a vastly complicated subject. We won't go there. But you can see these wedges are fairly representative in the population. It's not like Medicare takes care of a tiny amount compared to that. It's kind of the population is evenly distributed in those two groups. And you can see that Medicare and Medicaid are actually taking care of the oldest, the sickest, the poorest of us at a vastly cheaper price than where the rest of us are. Okay, so our current profit politicians are talking about how Medicare is going bankrupt, right? Well, that means they want to shift us over to more for-profit system opportunities because they think if we can decrease government spending on Medicare, the government will be okay. But what they're actually doing is kicking us into this mess where we can't track the money, we don't know what's going on, we don't have data, we have no idea, and that's so frustrating because they feel like they're being fiscally and economically conservative, and maybe they are from a pure standpoint of the government, but they're throwing the rest of us into this maelstrom that, as I've demonstrated, costs us all a lot of money. Now, Medicare obviously has problems. One of the huge ones is this. The Medicare drug law. I'm sure you're all aware of this. When this bill was passed, the drug companies were terrified that the government would have enough bargaining power to ratchet down prices. Now, of course, the drug companies will argue that if they don't get money, we don't get good drugs, but I'll leave that to you guys to explore how valid that statement is. The point is, they wrote into law that we as taxpayers are forbidden to bargain over prices. Whatever price they set, that's what we have to pay. And I don't think that's a great way to control costs. And there's another aspect where Medicare kind of hemorrhages money, and those of you that are older and dealing with this, and I know I'm kind of getting into the weeds, but you've got to understand this, because this is where our present politicians are coming from. There's this thing called Medicare Advantage, okay? And I love this Medicare Advantage ad because it says it right there. It sounded too good to be true. Where Medicare Advantage comes from is that sense that we all feel that the government's going to screw something up, but Anthem and Cigna and Humana, they're for-profit, man. They're lean, they're mean, they're going to do it right. So for decades, we've been convinced that if we give those companies the opportunity to take care of Medicare patients, they'll do it cheaper. But as I just described, they absolutely can't. But we believe they can. So right now, we as taxpayers are paying them about 11 to 12% more to cover the seniors in Medicare Advantage plans because we believe they can be cheaper, but they actually can't. Again, we're basically paying those companies to outcompete Medicare. Because with that extra money they have, they can offer cool things like, oh, no premiums, or healthcare visits, or, tennis, I don't know, they can offer all these extra things that would be so much cheaper if we just folded those things into traditional Medicare, but instead we insist on paying those companies extra money. And right now, that's the kind of stuff that Paul Ryan and those folks are talking about. When they talk about turning Medicare into a voucher plan, they're talking about giving seniors enough money to pretend they can pay for premiums, and then handing them over to Cigna and Anthem. And as a practicing physician, I can tell you that, the Medicare Advantage plans by law, they have to do some things right. But all they do is they bring the for-profit insurance world that those of us under 65 have to deal with to the seniors. So suddenly the seniors are confused. They have these massive co-pays. They've got higher deductibles. They don't know who's in their network. It brings all that confusion into Medicare. And of course, that confusion is not designed to help people get the care they need. It's designed to optimize process. We got co-pays on almost everything, limits on doctors. It costs us more. We're paying for this. More of that confusion and bureaucracy. And again, as I said before, Congress is actually paying those companies to outcompete Medicare. It's hard to say that Medicare is better when you're paying companies 12% more to do better than Medicare. And that's where a lot of the data comes from. That's why a lot of our representatives will say, oh, we have to support the Medicare Advantage companies because look at this data, they're doing really well. The counter answer is, well, why don't you just fold that money into Medicare, give people what the Advantage companies are giving them a lot cheaper, and just make it better for everybody. And there's something about Medicare that's really interesting. And don't worry, we're getting close to the end.
Hey, Doc.
Yes.
This lady has.
Oh, sure, yeah, I'm sorry.
Can you clarify, the difference between Medicare and Medicare Advantage?
Okay.
So 65, you can choose one or the other, and you're going to pay more for this Medicare Advantage?
You're not. That's the beauty of it. What happens with Medicare Advantage, if you're getting close to 65, you're getting deluged with advertisements to all these companies. And the way it works is we as taxpayers pay those companies more money so they can offer you a great deal, or what appears to be a great deal. That's why many of my patients with no resources have to get on a Medicare Advantage plan, because as taxpayers, we're paying their premiums for them so they can get access to some sort of Medicare-like service. And it gets real complicated because for some people, there might be certain advantages to certain Medicare plans in certain situations. But if you ask a social worker that handles like getting people in and out of the hospital efficiently, or if you ask any physician, they will all tell you the traditional Medicare and a Medicare secondary and a Medicare D plan is way easier to work with. It's
Is that cost the same, less, or more than Medicare?
We're really getting into something that starts to get super complicated. But in general, the Medicare Advantage plans are cheaper because, again, we as taxpayers are offsetting the cost. When you have traditional Medicare, you have to pay for a secondary and you have to pay for a drug plan. Sometimes they're
So the individual pays for that on the Medicare Advantage, they do not?
In general, it's so frustrating because there's all kinds of different plans.
I'm just trying to comprehend what you just said.
In general,
as someone who is not on Medicare,
in general, a Medicare Advantage plan will upfront be a lot cheaper. You'll be able to get coverage. You probably won't have premiums or very low premiums, again, because taxpayers are supporting you. But when you get sick, you might start running into deductibles. You might start running into real limits into what your drugs will cover. You might start running into network restrictions.
Okay.
So and each plan is different, and each plan is super complicated. And the hard thing is to find a broker or someone that can actually help you navigate this when you come to it.
So you're saying just regular Medicare is definitely less complicated and costs a little more up front, but in the end costs less?
Yeah, exactly. Medicare gives you the freedom to really see what doctor you want to see, but you're going to have to pay premiums. Okay, you have to have a premiums for the Medicare B, premiums for the secondary that you have to pay. Because remember, Medicare is not allowed to do what they wanted to at first. They wanted to just have Medicare take care of everything. But the for-profit insurance company lobby said, no, we don't want you to take care of everything. We bet that there's profit for us. I bet if we cover 20% of what Medicare won't pay, so Medicare only pays about 80% of your bills when you go into the hospital or see a doctor. Well, when you see a doctor. So people have to buy a secondary, a Medigap plan to cover that 20% so they don't get hit
That's
with
the
that.
B.
Yeah, that's the B. And that turns out to be very lucrative for for-profit insurance companies because they aren't taking care of all the care, they're just taking care of a subset of the care. And so that's how we've perpetuated the system where we've got Medicare taking care of 80%, but the for-profit companies touching in that 20% and the Part D getting their piece of the action. So if you go with standard Medicare, you're going to have to pay your Medicare premium, and then you're going to have to pay those for-profit companies for your drug plan and your secondary. But in terms of your freedom to see any doctor you want, if you get that weird cancer and you want to go to the Mayo Clinic, if you're on a Medicare Advantage plan, it's likely you won't be able to do that. Because in order to access our taxpayer dollars and free yourself from premiums and premiums, or to a greater extent, then you have to give up certain freedoms. And of course, the Medicare Advantage companies are brilliant at working the system to optimize. Every few months, they come into my office and they go through your charts. And they look for all the different diagnoses you have. Because if they can add more diagnoses to you, it has nothing to do with how sick you are. It's how you look on paper. They can go to Medicare and say, uh-oh, we ended up with too many sick people. You said you'd pay us. And Medicare will pay them based on how sick you are. It gets super complicated, but they're very good at gaming the system and making sure they make money. That's why our representatives can talk about voucher programs, because they know those companies will always be able to work things out so that they will end up being profitable. And they've already done that, again, because we pay them 12% more than it costs for them to cover Medicare patients. But if you're on the ground looking for a plan, if you don't have a lot of resources, if you don't have a lot of money, many times a Medicare Advantage plan is better because you aren't stuck paying all those premiums. And since you asked, it's more complicated than that. The Medigap plans, if you buy it with, this is how crazy our system is. I'm not just talking to the people that are in your Medicare age. Those of you that are not in your Medicare age need to understand this. The Medigap plan is crucial. Because if you're going to go on Medicare, that means 20% of your health care expenses won't be paid for. So you've got to get a Medigap plan. And by law, for the first year, you can buy a Medigap plan. Maybe it's 3 months on each side of your 65th birthday, something like that. But there's this range of time where you can buy a Medigap plan and they cannot rate you. Okay, it's just like Medicare. You say, I want this plan, and they can't look at how sick you are. They can't look if you're diabetic or obese or a smoker. They just have to give you a fixed, really good rate. Okay, so if you do standard Medicare, you want to make sure you buy your Medigap plan right when you can, because if you go outside that limit, then the insurance companies can say, no, you're a woman, you're going to get breast cancer. We're not going to give you a Medigap. We're not even going to offer you one, so you have to go to a Medicare Advantage plan. And then the weirdest thing is, if you go on a Medicare Advantage plan, you stay on a plan for more than a year, you lose the ability to buy your Medigap coverage without being rated. In other words, if you join Humana's Medicare Advantage and you quit within a year, well, that's okay. Medicare will allow you to buy your Medigap plan a lot cheaper. But if you stay on the Medicare Advantage plan for over a year, you've lost your ability to go back to traditional Medicare, because you probably won't be able to get a Medigap plan, because the insurance companies will look at your age and look at how sick you are and say, no, we can't make money off of you. If you bought it when you were 65 and healthy, yeah, we agreed to go to this lower price. That got us off topic. I don't know. And it is. Literally, there's books this thick trying to answer the question you just asked me. So I apologize if I can't give you a clean answer, because it's not clean. It depends on if you're working, if your spouse is working. And it's all there to protect the sanctity of the for-profit insurance model. Okay, all of those rules, all of those regulations are there because we believe that the for-profit companies can do it better, so we make sure there's room for them when all we really need to do is pay a tax, get it to Medicare, and have Medicare pay our doctors.
That would run all the insurance out of business, though, right?
Well, exactly, and obviously they're fighting that tooth and nail, but it's also the way we are. Like I said, if you get your amygdala triggered by saying you don't want a government to take over healthcare, everything I'm talking about disappears. All of the reality of the craziness, the bureaucracy, the cost disappears, and you're just scared, and you don't want to change. So they have an incredible inertia too. But let's look at, and you know what, you were raising your hand. Someone was raising their hand over there as well.
Yeah, I was just going to say that when I investigated a Medicare Advantage plan, it turned out, yeah, it was cheaper. But the closest, the closest non-emergency care, what do you call it?
Urgent care.
When you go to ReadyMed.
Yeah, right.
The closest ReadyMed they had was down in Decatur.
Yeah, you see, that's what people don't realize. They sign up for the Medicare Advantage because it's so obviously cheap, but they end up with booby traps like that. And if you stay on it for a year, you may be stuck. But let me back up, because this is just another amazing slide. Remember we talked about how America's life expectancy isn't that great, but people argue about whether that's real or a statistical fluke based on various things. Well, people have gone in and looked at life expectancy based on age. That kind of eliminates any confounding variables about premature babies and all that other stuff. And they find this. When we look at America, up till about 60, 65, we don't do very well. This is the United States ranking in terms of life expectancy. So even if you've gotten past prematurity, if you're 15, 20, 25 years old, you still don't do as well as people in those other countries. But once you get to 65, suddenly we take off. Suddenly America is stellar. Okay? Now once again, correlation is not causality. This could be an indication that we are living our lives totally out of balance, and we kill ourselves at work, and if we make it to retirement, we finally can calm down and get zen and take care of our lives properly. And that's probably part of it, but it also probably is due to the fact that traditionally when people got on Medicare, often their employer providing the cost for the secondary, suddenly you had access to all the doctors you needed, okay? People don't go to doctors for fun, but it's a lot more reassuring to know that you can see a doctor when you want to, and you're not going to go bankrupt. And again, this is the Medicare eligibility age. So this is, okay, we're coming into the money part, and like I said, it really is getting close to the end here. But you know, when Senator Sanders started to really introduce Medicare for all, there was a lot of, there still is, oh my gosh, we can't pay for it. Oh my gosh, it's too expensive. Oh my gosh, it'll bankrupt the government. But most of the studies that looked at it, you have to really look at the study, because if you only think about its costs, well, you know, of course it's going to be expensive if we put everyone on Medicare. But if you realize the benefits, getting rid of all the administration, all the bureaucracy, being able to bargain over drug prices, there's incredible savings. So yes, you know, the Medicaid rate adjustment, we have to pay more for Medicaid patients, covering the uninsured, increased utilization, meaning people actually go to the doctor and take care of themselves. Yeah, that's going to add cost. If you stop there, that's where our current crop of politicians stop. You know, they say, oh my gosh, it's so expensive. They don't include all of the incredible savings that are available. And we see this when we look at these studies. These are a couple of studies that came out when Senator Sanders was offering his single-payer plan. And again, I encourage you to not believe me. Look at these studies. Look at the news. These, you know, basic. I apologize. These are the studies that came out when Senator Sanders was offering this, and they didn't look at the savings. So obviously, they were able to say, "Oh my gosh, Medicare is too expensive. These people are crazy." But I'm hoping that from seeing some of the slides I've showed you, that it's not crazy. If you start looking at the savings, suddenly there is some money to be saved. Suddenly we could be having more take-home money, if we switch to a single-payer system. And this is the one that just came out. This is kind of funny because, again, there's been a recent surge in single-payer stuff. I think when he reintroduced his bill. So Charles Blauhaus, one of the institutes, Mercatus Institute, came up, did yet another one of these studies where he didn't include a lot of the savings, and of course, this is what we see. Okay, oh my gosh, it's going to be expensive. 3.2, no, that's how much Washington Democrats' single-payer health care proposal will cost over 10 years. Even doubling all federal, individual, and corporate income taxes wouldn't cover this cost. It's just absurd. What's absurd is not remembering that doing this eliminates all those premiums, all those copays, all those deductibles that are basically going into the for-profit insurance realm. And the really amusing thing is, you know, this paper here that prompted people to say this, when people dug into it, oops, when you looked at the numbers based on some of the calculations, they actually found that Medicare for All actually did save money, even though they were trying to prove that it didn't. And we got to go back to this concept of the regressive healthcare financing, which is what we have now. Fixed insurance premiums, co-pays, deductible costs, that eats away at your income unless you're a high-income earner. And we have to remember that all of us are paying money not into Medicare, we are paying money into Medicare through those taxes, but we're paying a whole bunch of extra money to those for-profit insurance companies to support their shareholders. And if we stop wasting our money on all that bureaucracy, we can begin to get more regressive system. And what does progressive healthcare financing, where the more you make, the more you pay. And this is just to give you an example. I always thought that progressive meant if in this case, if you from $0 to $10,000, there's no tax. So as soon as you make $11,000, suddenly you have to pay, in this case, a 15% tax. That's not how it works. A progressive system means that you simply pay this 15% on the amount over $10,000. So in other words, if you make $10,000 and $100, your tax isn't $1,500. It's 15% of that $100 or $15. That's how a progressive tax works. It's not piracy as you make more money. It just incrementally adds. And this is the basic tax structure that's included in H.R. 676, which is the traditional single-payer Medicare all-for bill that's been around for a couple decades. And it is progressive. I'm not really going to go into this too much, other than to say that when economists look at these savings, when they look at getting rid of the bureaucracy, when they look at maybe negotiating over drug costs, they find that with a Medicare for all single-payer system, 95% of Americans will actually end up making more money. Because again, that money isn't going to support shareholders and executives and marketers. It's just going right into the healthcare system. So for instance, on this graph, people making $25,000 a year, they're actually going to make a bump in income. And again, this is assuming that employers will take that money that they had been spending on insurance and give it to you as salary. You can argue about whether that might happen or not, but if every American knows it's there, then it might be harder for employers to withhold that. And even people making over $200,000, they still get a bump. It's a tribute to how expensive our healthcare system is and how much money we waste. Now, once you start getting about $450,000 or $3 million, yeah, the tax system in H.R. 676 is progressive. So if you're making $150 million, yeah, we're going to tap you for that. And if you're really interested in it, Healthcare for All Texas has a great online calculator based on that tax strategy, what it would mean to you. And just to kind of give you an idea of what your options are. And just to really drag this out, there's a lot of other ways of doing this tax that's equitable and fair. And Senator Sanders has several different ones. I'm just going to click through this. I'm not going to bore you with it. My point is there's many ways to skin this cat, and all of them appear to be a lot cheaper than paying insurance companies to provide us with inclusion. And that's simply the point of this slide. There's many other options for the national debate, but they all put American families in a positive situation in terms of income. Okay, so back up here. This slide is the one that I think I've had to hire off-duty policemen for, okay? And I'm not asking you to believe this. Again, evaluate it yourself. This slide, though, is what insurance company executives don't want Americans thinking, okay? They don't want us thinking in terms that Medicare might be cheaper, okay? It might be better insurance, because you don't have to worry about networks with traditional Medicare. It might be more solvent. Again, I can't say this enough. All of this money goes somewhere else. It doesn't go into the healthcare system. And of course, everyone worries about the government rationing. And I can tell you, my experience as a physician is every time someone in the government starts to ask questions like, should we be paying for this treatment? The data doesn't suggest that it's all that great. There's these, as you know, the death panel screams immediately erupt. So in my mind, it's going to be hard to ration because A, it's hard to ration even when it makes sense. And certainly if we're all in the same boat, I think it's really hard to truly visualize the government administrators standing there and letting people die in the streets. And the other thing that's super important is maybe we might all pay attention to Medicare. You know, the ways that it hemorrhages money, the way lobbyists have extort Medicare to make sure they get extra money, the way Medicare Advantage plans are extracting money from us. And finally, we might have a more systematic approach to public health. We might not allow tobacco companies to have First Amendment rights. We might want some really gross photographs. We might want to look carefully at public health issues like nutrition. We might want to see if we can get schools with the extra revenue from not having to be tied up with shopping for insurance plans and dealing with all that kind of stuff. And there's real reasons to think that it could be much better on a number of levels. But again, all I need to do is say, wait a minute, you don't want the government taking over your health care. And, oh, I had a friend in Canada that had to wait 6 months for the hip replacement. And all this kind of disappears. But this is what's happening. The money is disappearing. Even if you're 100% healthy, your money is disappearing into our healthcare system. And as I said earlier, I think the real mover for single payer isn't going to be us in the streets. It isn't going to be you guys worried about money and struggling to see a doctor. It's going to be these companies going, wait a minute, this is a waste of money. We can make more money. Well, we can save money by just going to a single payer system, and then we can do the business that we love to do, that we want to do, and not be in the business of providing insurance. And even some conservatives are realizing that this single payer concept, even if you don't agree with it, it really deserves at least a place on the table. This is a great article, this conservative case for universal health care. You can print that up and hand it out at Christmas time around the Thanksgiving. No, don't, because I think, as I explained, you're not going to be able to convince people of this. Just let them talk. Find out what they're scared of. Find out what they're worried about. And now you have this knowledge about how the for-profit insurance industry has tweaked things. Everybody traditionally blames it on the government. Oh, this is too expensive. That government gets in the way, or Obamacare messed it up. But now maybe you can begin to understand how it's actually the for-profit insurance model's influence on the government that may be the fundamental source. And if you want to go into this deeper, there's a couple of websites. Healthcare Now is real good. Physicians for the National Health Program, they have a great section, frequently asked questions, that kind of goes over this. And if you want to get a little bump every day to really understand how crazy our healthcare system and how manipulated it is, sign up for the PNHP quote of the day. Don McCann is a great healthcare analyst, and he combs the literature for evidence of just more specifically how crazy our healthcare system is. All right, I'm going to finish here. So number one, you won't hurt my feelings if you want to get up and run out of here. If you want to stay and ask questions, we'll jump right in and do that, and I'll try to answer that as best I can. And if you have questions of your eyes, go ahead and hit me with that too. Let me go ahead and hit you there.
Another good website, if you really want to pay attention to the horror stories, is one called Healthcare Renewal.
I had not heard that. That's okay. Healthcare Renewal.
Yeah, it's written by a doctor. And one, he's mad because he figures the doctor's killed his mother, and he has an absolute hate for computerized medical.
Yeah, that starts to get into.
On the other hand, his stuff about the pharmaceutical industry is really interesting.
Okay, what was the name of that site again?
Healthcare Renewal.
Healthcare Renewal. Thank you. Yes.
So as a physician, by the way, I'm going to commend you as a physician for taking the people's point of view. So I think you deserve a round of applause. My question is, how much grief would we get from the physicians of the world if we told them that we were going to go to either, a single-payer Medicare for all, because they're going to get lower reimbursements potentially, or if we went to a socialized medicine model, they essentially go on salary.
Right. Yeah. Well, first of all, I think the socialized medicine model is never going to happen. I think it's going to be a Medicare for all, where doctors can run their practice the way they want and still generate revenue in the traditional way. And yeah, you're going to find doctors that just think I should be drawn and quartered for talking about this stuff because they're convinced that Medicare will be a nightmare, they'll be bankrupted. But if we look at some of the single-payer, systems around the world, particularly Canada, doctors actually end up doing rather well, first of all. Second of all, the doctor's offices are freed of all that billing. I remember, talking to Joe Dorco when he was head of the Lutheran Health Network. He said, if I just knew I was going to get Medicare reimbursement and I didn't have to have 300 people doing my billing, I could make that work easily. okay? And the final thing that's super important to understand is we talked about how the for-profit insurance companies kind of tweak Medicare to get, money and options and increase their compatibility. But because our politicians feel fundamentally that the idea of social insurance is bad, they just don't like Medicare, okay? And part of what's been happening to Medicare is it's been piling more and more bureaucracy onto doctors. Now, some of that is a genuine attempt to improve quality outcomes. But I have to think that some of it is this idea that if we get doctors sick of Medicare and patients sick of Medicare, then it will be much easier to transition people to voucher programs where they have to buy their insurance. And all that was to say, doctors tend to hate Medicare with all the hassles. But I think if the doctor sits down and realizes that he can get rid of all that billing craziness, he can suddenly just get regular revenue without fighting things. If we have a systematic healthcare system, again, we don't have a healthcare system, maybe we can recognize where the fraud is, where the bad outcomes are, and really begin to focus on that rather than piling bureaucracy on top of doctors. But you're always going to find doctors that are afraid of that. And the fundamental thing is that I don't understand is how you can go to work as a physician and see people dying, strokes in the emergency room, and not desperately want to change that, even if it meant, oh gosh, maybe not a bigger car. And that's the fundamental problem. Those other healthcare systems, they're monitoring things. So when someone doesn't get a hip replacement, everyone knows about it. And then the people can decide if they want to up their taxes and fix that or not. In America, no one's in the emergency room counting who just died, who got a stroke, who's on kidney failure, who went blind because they didn't have insurance. It's so internalized that it's normal for us that no one is their voice. And it's happening, I love it when I give these talks and someone talks about some anecdote in another healthcare system. You've got to be really careful with that because obviously that's heartfelt, it's fear, it's that amygdala. But I also feel like I have to point out every day of my career, I've seen way more people in that situation. But in America, we don't notice it. We just allow ourselves to pay more and more money. Long answer. Hopefully that helps you a little bit. Thank you. Yes. You're Chris, right?
Yes.
Okay, nice to meet you.
Hi. I just wondered if you could speak to the contradiction of so-called enabling people to shop for health care when they really can't shop during emergencies.
Yeah. Well, that's again one of the fundamentally ridiculous things about this whole high deductible healthcare system is that, when you're sick in the emergency room, you cannot shop, and that's where people get these massive bills from doctors that aren't in the network and all that kind of stuff. To me, that is just so obviously a problem that it just, why do people continue doing this? And then there's lots of research that shows even if you have the opportunity to shop, people don't know how to do it. There's no app that says, okay, how much is the chest x-ray? Because I don't even know what my fee is going to be. I have a charge, but I don't know what the insurance company is going to pay, so you can't even figure out what's going on. So people tend to not shop. As a matter of fact, Medicare D, which is supposed to give seniors a chance to shop carefully for their drugs, studies suggest that 90% of seniors are not on the optimum Medicare D plan, even though we as taxpayers have paid for a pretty cool program to help them do that. It's when you're really sick, you can't do it, and even when you're not sick, it's not the way we're designed.
Well, you're not skilled enough.
Exactly, yeah, it's just...
You don't know when the doctor tells you what's the matter. If it's something serious, what can you do besides trust the doctor?
Right, yeah, there's that, and it's just, again, like I said, it's so confusing to call, and then if you're really shopping and comparing, and if you find a cheap price, you're going to get a good scan. Is that surgery center actually going to be cleaning these instruments? It's not going to be flipped, because usually all those things are heavily regulated.
And one of the other things is, especially with your kids, vets are cheaper because you can put your dog down.
Right. Yes, so a very wise friend of mine, our acquaintance, he said, the one thing he wished we could all have in our closets was a golden retriever suit. So when we get sick, we could put it on and just be escorted off the planet civilly without being stuck in it and taken care of. Yes.
I just wanted to comment. I'm on Medicare, and I'm an ex-RN for 30-some years locally. And on the positive side of Medicare, which I know the bureaucracy and all that healthcare and doctors don't like, the Medicare system has the power to affect change of outcomes. Is that not true? Especially they change practices such as if you go into the hospital and you end up with a certain kind of an infection, that Medicare won't pay for that hospitalization, and the hospital has to eat it. It encourages the hospital systems to do best practice, which I always consider to be a good thing.
Yeah, it's super complicated because the people being exposed to those best practices may feel they're not valid. But your fundamental point is 100% correct. Aetna, Humana, Cigna, they just take care of people for a few years. They want to get the money from the patient.
Right.
Again, obviously they're good people trying to do good work, but they are interested in actually improving the healthcare system. It's not in their benefit. They'll say they are, and I think they do try to do some of that. But Medicare is the only one with the data in the cloud. We don't see the for-profit insurance company data. We don't know what their outcomes are, but we can look at Medicare data and see which doctors spent more and who's having more redos. And again, that's a super complicated subject because if someone's dealing with sicker, more complicated patients, they're going to have worse outcomes. We need to figure out how to allow for that. But there's no question that Medicare is much better able to identify and exert that kind of change. And Medicare is also much better able to find fraud. You know, all the insurance companies say, oh yeah, we find fraud. Well, the only fraud I see when I Google fraud and for-profit insurance is the fraud they're being sued for having committed it. You know, but Medicare, we don't give Medicare the tools it needs to really look for fraud, but Medicare actually can find that stuff better than a for-profit insurance company.
Thank you.
Yes?
So is Canada's system, are they single payer or are they socialized?
Yeah, okay. The term socialized medicine means a lot of different things to different people. And as a result, we try to stay away from that. The general connotation of socialized medicine means what he was alluding to, the government, the doctors in the hospitals work for the government. Yeah. And you know, that's like the VA. And there's just no way I can see that happening in America.
Right, but is that what they have in Canada? Or
No, Canada is much closer to a Medicare for all. As a matter of fact, Canada's health insurance is Medicare, where everyone puts in a little bit, and then the Medicare pays for a large part of their health care. And of course, Canada does have issues, okay? They've got the lines, they've got the queues, but I think if you talk to the vast majority of Canadians, they're so pleased with the fact that they know that they can see someone, and yeah, maybe a bit of a hassle. And of course, we get all the anecdotes of Canadians coming to America, but we don't get the interesting data that many of those Canadian doctors that came to America are going back to Canada because they're sick of the bureaucracy. They're sick of their patients getting sick and not being able to do what they want with them. And we don't hear the contentment of the average Canadian. We hear the discord, but not the
Well,
contentment.
because in my conversation with people, I mean, that's initially what comes up. Well, look at the problems they have in Canada, or you have to wait for your elective
I think,
procedures for
you
so
know,
long. What's the response to that?
Yeah, well, first of all, no one is asking for a Canadian healthcare system in America. You know, in a sense it is, because we put money into Medicare and it provides things, but it's just, you know, it's great to look at these other healthcare systems and try to learn from them, and then you can say, well, what about, you know, Sweden and Norway and France and Germany? We can always find problems with Canada, but Canada often doesn't come up that well in the ratings. It's these other systems that do better that we ignore. So one aspect of that is saying, yeah, we don't want to be like Canada. We can learn from them. How about these other systems that work? But let's get back to
What are they employing then?
I'm sorry?
In Norway, what are...
I'm not an expert in healthcare systems. I can go back to that one slide that showed you there's all kinds of different ways. It's just the point is that discussion doesn't happen in America. Okay, and that's what I would deflect people to go back. So, see, the healthcare system actually makes your argument, but if they get you tied into things like, well, what about Canada, or is healthcare a right? It spirals out.
I'm just looking for a good response.
Yeah. Well, you know, that's the best thing is just like, well, what's your experience with our healthcare system? You know, what do you think of it? What are you worried about in terms of money? What's going on with you? And then they'll start talking about how, well, Obamacare messed things up, or, you know, the government screws things up. And then you can maybe say, well, wait a minute, why did those things happen? Is it because the government did that, or is it because lobbyists got the government to do that?
Right.
You just kind of sidestep the whole Medicare for all. And then if you can, the funniest thing, you guys gave me the microphone, so I'm going to keep talking. But I gave a talk like this to a very conservative group. And the absolute most wonderful experience was after I presented all this, One of them was like that robot in the Star Trek episode where Mr. Spock says, "I always lie, and I'm lying to you now." And then the robot like, wait a minute. Because I got to him enough that he was going, I hate the government, but I don't think I like the insurance company, so I don't know what I want to do. I mean, that's the best you can do. Just create confusion so that maybe people will open their mind a little bit and watch how much money they're spending, watch the confusion they deal with, and then wonder if maybe there's a better way to do this. You know what? You had your hand up.
Just before you release, what can we do? What's the action step that we should take if we want to support?
Yeah. Oh man, I've been doing this for years and I still don't know. I think the basic thing is plug yourself into one of these groups. This is for, everybody. This is run by doctors, but anyone can join it. And these people are more in touch with the activist things that are going on. What you can say to your politicians, what meetings are occurring, data to help you talk to people about this. Again, the healthcare system is the best argument we have for Medicare for all, but people don't realize it. So I think educating people non-judgmentally, like I keep saying, I don't want you to believe in Medicare for all, I don't want you to believe in single payer, but I want it to be on the table. Let's have a serious discussion about it. Let's not limit it to Medicare for all will turn into Medicare for none. So, someone had a question?
I was just going to comment on the thing on rationing.
Uh-huh.
Every system has rationing.
Oh, yeah.
The system that we have now rations, you've got a lot of money, you get what you want.
Yeah, you saw that in the chart.
Yeah. So everything rations.
Mm-hmm.
It's whether it's It's whether it's reasonable rationing or rationed on some form of power or prestige.
And that's where we go back to the huge cost of the American healthcare system. We're spending almost twice as much money as every other country. If we got that money actually into the healthcare system, we'd probably have people living to 300 years old because I think Karen's standing up here, so I'll be around downloading stuff. If you have more questions, feel free to come on and hand it to the boss.
I just have a couple of quick announcements. Our next meeting of the minds will be on October 21st here at 6 o'clock. That's a Wednesday, third Wednesday in November. And our next event will be at the Community Harvest Food Bank on November 10th, 8:30 to 11:30. We're closed-toed shoes, dress appropriately, we're looking at a warehouse. So you're welcome to come in either one of those. And with that, help yourself to some refreshments. There's lots of it back there.
Still coffee left.
Yeah.
And thank you guys so much for coming.
And to you.
For taking your time to do this.
No, you're not tonight.
Right, yes. Here comes the alcohol.
I know what the front of your eye does. I know what the retina does. What is this macula?
The retinal line is back in the
Yeah.
the macula is sitting in the
Sometimes.
I work in over here, but
It's just a description. Wonderful.
it is complicated.
Oh, okay. It's part of the retina.
Yeah, it's just most important.
Okay, so it focuses on something.
No, the focus is.
Take your money out of my
The macula is just like when you take a